The International Health Regulations, or IHR, are legally binding rules to help the member states of the World Health Organization prevent and respond to acute public health risks, such as the spread of disease, while limiting interference with international travel and trade. In 2005, 194 countries across the globe, including Uzbekistan, agreed to implement the IHR. Because the IHR are legally binding, it's essential that each member state has an appropriate legal framework in place to ensure it fulfills all of its obligations and knows its rights. In Uzbekistan, during 2013, a series of activities was conducted to support the IHR implementation process. This culminated in a joint roundtable discussion with representatives of Uzbekistan's Legislative Chamber of Parliament, the National IHR Focal Point, and WHO. Addressing the assembled representatives, the Deputy Minister of Health, Dr. Saidmurat Saidaliyev, noted that in a new world where population grow and move, diseases travel fast, microbes adapt, chemical, radiation and food risks increase, health security has to be strengthened. The key topic of discussion was the resolution of the Cabinet of Ministers. The representatives of the National IHR Focal Point reported on the work done by drafting the resolution and were keen to underline the importance of collaborating with legal experts. The resolution proposes legal backing to the National IHR Focal Point. Additionally, and crucially, it proposes the National IHR Focal Point to facilitate needed national intersectorial collaboration. The participants had a chance to share options, express concerns, and discuss both challenges and opportunities.
The International Health Regulations has been written by lawyers. Many technical experts find it very difficult in their daily work to adapt these international regulations into their daily work. So that's why we offered this week two things. One was that we had a consultation with the policymakers in the Ministry of Health and the members of the parliament on what could be changed in the legislation of Uzbekistan. The second part focused on training experts at airports and land crossings. We invited about 40 experts from different sectors and from the provinces and really helped them to understand what it means in practical terms to adopt the IHR.
Preventing and controlling the international spread of disease is a fundamental element of the international health regulations. A number of IHR requirements apply to ports, airports, and ground crossings. They entail close collaboration with the other UN organizations, such as the International Civil Aviation Organization, the International Maritime Organization, the World Tourism Organization. Close collaboration is also required with the industry associations, such as the International Air Transport Association and the Airports Council International. Ports, airports, and ground crossings requirements were discussed during a 3-day professional training course on points of entry. The course was conducted in the Department of Hygiene of the Tashkent Institute of Postgraduate Medical Education and supported by the World Health Organization. It was attended by professionals from IHR National Focal Point, public health specialists, the professionals from related public sectors, agriculture, transport, tourism, education, national and international organizations.
The international health regulations are one of the important treaties in international law that promote public health in all countries. I would also like to mention that state parties are requested to mainly fulfill 6 important tasks in order to be fully compliant with the international health regulations, namely the establishment of a national IHR focal point, which is usually an institution, but also the sharing of information regarding disease outbreaks in a timely manner, the surveillance and response capacity establishment, the so-called points of entry provisions, which means that there's particular designated points of entry, in the case of Uzbekistan, through airports or land borders, that are highly alerted towards the transmission of diseases and the adequate response to them, and also the compliance with other duties in international cooperation.
During the second day of training, participants tested their knowledge in practice when they visited a ground crossing with neighboring Kazakhstan. On the third training day, participants worked in groups discussing case studies of emergency preparedness planning in IHR. Participants then presented their case studies, and experts from the airport and ground crossings provided feedback. The international health regulations are fundamental in protecting global public health security. For it to succeed, each country must actively participate. As a member of a global community that protects our future from the threat of disease, Uzbekistan has taken major studies in the implementation of the international health regulations.